week, Centricare doctors saw an increased number of patients coming in with infectious mononucleosis, also commonly called mono. Now, we see mono mostly in teenagers, but also young adults are at risk. The reason is that it's during those teenage years that we're exposed to the virus, but once we've had the infection, we have antibodies and immunity for the rest of our lives. So we don't typically see adults getting mono. I think the oldest adult I ever saw with mono was about 32 years old, but that was pretty rare. I've seen very young children, age 4 or 5, also get mono. So it is an infection anybody can get if they're at risk, and that means they've never had mono before. Now, if we don't see it that commonly in adults, it's because we had an exposure. Now, most of us don't remember ever having mono. Myself, I've never had mono, but I know I'm immune because I've been exposed to a ton of people with it. But mono is difficult to catch. It takes droplets, those exposure to the saliva and the secretions from somebody, therefore known as the kissing disease. But don't tease your teenager if they get mono. It hasn't been because they've been out there doing anything they shouldn't, but because it's just one of those things that happens to high school students. Now, the parts of the body that are affected, typically going to be the mouth and throat. The throat's going to be swollen and inflamed. You're going to have enlarged tonsils, also enlarged lymph nodes. And the next, you have these big bulging lymph nodes. One of the first things that tip me off it is mono is those large lymph nodes or swelling in the neck, but also can cause swelling in the spleen. Now, if we kind of tilt back here so we can see, up in here is where the spleen is located. This is the liver. Spleen's on the other side, on the left upper side of the abdomen. And that can cause some swelling, and that's a concern with kids that are active in contact sports because a blow to the abdomen can actually cause a rupture of the spleen. So that may be why your doctor tells you if you have mono to avoid contact sports.